Kia ora koutou katoa. Good evening, everyone. Earlier this afternoon, I was advised of a new case in the South Auckland community. The case is a family member of a student from Papatoetoe High School. That could provide a straightforward explanation for this infection, but in this case, it has not. The Papatoetoe High School student in the household has tested negative for Covid19 on 3 separate occasions and currently has no symptoms for Covid19. That means we have no current known link for the case discovered this afternoon. Genome sequencing is currently underway. As everyone will now be familiar, this will tell us if this case is linked to the small outbreak we have been dealing with. At this stage, we strongly assume that it will be. However, as we all know so well, if we cannot immediately link a case person to person, what we call an epidemiological link, that is a significant issue and one we need to act on. The second cause for concern is the exposure that the current case has had with others. Because they have been infectious for as long as a week and have not been in isolation, there are a number of high-risk places involved in this case, including a supermarket, a gym, and the Manukau Institute of Technology. These are well-populated sites, and given the time that has passed since the onset of their illness, we may well have close contacts who are already infected. Based on this, we are in the unfortunate but necessary position of needing to protect Aucklanders once again. That is why Cabinet met this evening and made the decision that Auckland will need to move to Alert Level 3 for a period of 7 days. The rest of New Zealand will move to Level 2. The 7 days in this case, relative to, you'll recall, a shorter period last time, was the length of infectious period we have had this case in the community across a wide range of sites, and the fact that we must assume it is the more infectious variant that we continue to deal with. The Level 3 remains the same as you'll recall from earlier in the month. That means the main thing we are asking people in Auckland to do is to stay at home. Reduce the risk of any spread. That means staying in your bubble other than for essential personal movement. People should work from home unless that is not possible. If you go outside your home, maintain physical distancing of 2 metres outside or 1 metre in a controlled environment where you know the others present. We are asking children, sadly, once again to stay home from school. But you will remember that in Level 3 schools, years 1 to 10 and early childhood education centres can open for children whose parents must or need to be at work. Supermarkets, pharmacies, primary produce retailers and petrol stations can remain open. So please, again, there is no need to rush to your supermarket. But we are again asking all other businesses that usually interact face-to-face with customers to move to non-contact methods, click and collect or online ordering. The main rule here is maintaining physical distancing between staff and not physically interacting with customers. Public venues will be closed. For example, libraries, museums, cinemas, food courts, gyms, pools, playgrounds and markets. Gatherings outside of your bubble are prohibited with the exception of groups of 10 for wedding services, funerals and tangihanga. Physical distancing and public health measures legally must be maintained where those events are occurring with just 10. Unfortunately, this means that all sports games, along with all gatherings, need to be cancelled. This includes the Auckland Round the Bays, which I know many of you would have travelled and trained for. Healthcare services will revert to using virtual non-contact consultations where possible. Interregional travel will be highly limited. For example, people can go home if they are in Auckland and that is not activated. There is no need to reapply. Those who don't have an exemption and need to travel through the border can go to the MB website. People at high risk of severe illness, such as older people and those with existing medical conditions, are encouraged to stay at home where possible and take additional precautions when leaving home. If you're in Auckland, we of course ask you that you use a face covering if you need to leave your home. The order that we put in place in order to create an enforcement regime around level 3 will take effect from 6 a.m. tomorrow morning. That is 6 a.m. tomorrow morning. We do ask people, though, to adopt those level 3 standards and rules as soon as they can, but we accept that obviously it is late in the evening. The order will be coming in place from 6 in the morning. Some will ask whether we should have stayed in level 3 from the 14th of February right up until this date today. To date, that was not what the evidence required, and therefore it was also not the advice that we were given. And you can see why. 118,000 tests were undertaken across New Zealand since the COVID case on the 14th of February, and no cases were found outside of those known contacts. Wastewater testing showed up negative. We had tested every Papatoetoe High School member, and in most cases, twice. All positive cases were in quarantine, and all close contacts and casual plus contacts were in isolation and were to be tested not once, but twice also. But there is no doubt that a contributing factor to the issue we are now facing is that the guidelines and indeed the rules have not always been followed. People who should have a certain future as our vaccination program rolls out. We just need to hang in there. I'll now pass to Dr. Bloomfield to provide some additional details on the case and what we know, and to list possible exposure events linked to this latest case. I'll then come back very briefly before we'll open for questions. At the conclusion of those questions, Minister Robertson will take the stage and talk to the business support we'll be making available.
Thanks, Prime Minister. Kia ora koutou katoa. So I'll just give a quick summary of what we know, what we are still finding out, and some specific advice I'd like to give here tonight. The case and an older sibling of a Papatoetoe High School student. As the PM mentioned, that student was a casual contact as part of the school community. It has returned 3 part of the school community. It has returned 3 negative tests and is asymptomatic. Our public health team at Auckland Regional Public Health is undertaking interviews to establish just how this case may have been infected. Initial testing of other household members, that's 4 other household members, has been completed. And the preliminary tests show that 3 are negative and 1 additional family member, the mother, has a positive test result, and it indicates early infection. Back to our case M, he developed symptoms and we're expecting that back late this evening. That will help us identify and I expect confirm the link to the existing cluster, but that will be later this evening. Now, there are details on current locations of interest which we will progressively provide. These are places the individual went to when they were potentially infectious, and where we will be providing advice to people who are at these locations at the same time about what action they should take. They will be on the Ministry's website. There will be more detail about the Manukau Institute of Technology and also a gym that the person visited. I don't have the details of that. It will go on our website as soon as we have that. In the meantime, there are 4 locations of interest I'd like to just provide a little bit of detail on. One is the Pack and Save in Manukau at 6 Cavendish Drive. On the 21st of February between 5:30 and 6:40 p.m. There is the Burger King at Highland Park in Half Moon Bay. In Half Moon Bay, 25th of February between 8 and 9 p.m. The Hunter Plaza at 217 Great South Road, Papatoetoe on the 26th of February between 2:55 p.m. and 5 p.m. And finally, Your Health Pharmacy at 488 Great South Road on the 23rd of February between 2:45 and 3:50 p.m. People who were at those premises are regarded as casual. Is that people have these symptoms, then they should also be tested. And I think particularly for younger people who might be putting these symptoms down to something else, they may not be seeking advice about getting a test, and I'd like to encourage everybody to do so. In this case, this person did get symptoms and sought advice and was tested. We now know about this case and we can take action accordingly. Over the last week, we have adapted our contact tracing system and used it extensively to try, and there have been several hundred people as close contacts who have been contacted daily and followed up by our public health units around the country, working on behalf of our Auckland Public Health Unit, and more than 2,000 casual plus contacts who have also been followed up through our contact tracing. However, we are now in a position where we have, with this latest case and the mother who's just tested positive, a number of potential exposure events that have occurred over the last week or so, and there may be infected people from those exposure events, and we need to prevent those people going on and infecting others. We need to be confident that that is going to happen.
Are you confident that that person got the message that they needed to self-isolate and you communicated that clearly enough?
I'm confident we communicated it clearly. I've seen the records of the multiple communication that went to members of the school community, advising them of what was required of both students and wider household contacts. Look, obviously in this case, despite that communication over what was expected, that has not occurred here. We have a test though, and ultimately we need that test to make sure that we are not putting other people at risk. And so I don't want to create an environment where an individual who has made mistakes here gets so pilloried that no one wants to be tested. That's not a healthy environment for anyone. I'll let you finish your follow-up there.
Are you looking at giving people more support? Because at the moment you've got a situation where people don't feel like they can stay home. They're going to jobs, they're going out and about. Do they need more financial support from the government?
That financial support is there. So we already anticipated that this would be an issue, and so that financial support is there. Keeping in mind that actually the individual in question here, one shift was worked. Actually, if someone is required to be isolating as a requirement by health, they are eligible for a COVID payment in that regard. If they are required to stay at home for a test, they are eligible for a payment. So we've covered that. Unfortunately, still we've had breaches of what's been required in this case.
Something that the government can do to enforce that isolation now, and should you also be looking more seriously at mandatory scanning, given that this is the way we're going to try and navigate this new normal?
Yeah, and look, obviously we have had a number of cases now where scanning hasn't been taking place. It wouldn't necessarily have prevented what we've got here because we have a situation here where we had isolation requirements that haven't necessarily been followed. That's been an issue in another case as well, and it started even having the conversation about what to do. So ultimately there has to be a cut-off. We've chosen what it is. This will get in front of a number of large gatherings, such as church services that will begin on the Sunday morning. But of course, it's not always perfect. There will be events underway. I'll come to you, Henry.
What would your advice be then to bars in Auckland, the people in bars in Auckland right now who are out? Should they go home?
Look, we're not creating a scenario here where we are criminalising people midway through the evening. Of course, the ability to police that, it would not be orderly. So the orderly decision, of course, is to have the order come in at 6 a.m. If you have heard this request now, of course we want people to act as though they are already in level 3, but we are realistic, Henry, about the fact that people will already be out. Of course we want them to act now, but we accept that in some cases won't necessarily be an effective mode.
Bloomfield, the fact that you said...
I just had a couple more here, Tova, and then I'll come back to Dr. Bloomfield for you. Yeah.
Can I just confirm what time the person had the test? Because they were at Papatoetoe City Fitness late yesterday afternoon.
Yes, so my understanding is they visited the GP in the afternoon and had the test, and I think, and the information I have is that they went to the gym after they had the test.
How frustrating is that, Prime Minister? I can see that on your face.
Of course it's frustrating. Of course it is. You know, we keep in mind, and I know people will say, should we have continued on in an alert level all the way through for the last 13 days? Actually, some of the issues we've had have been that very specific groups of people were never meant to have come out of isolation. And so that's been part of the complication. I would say, though, and let's be fair.
And it comes back to the point I made, is we have seen with this variant, because of these unusual symptoms, and also it's proving to be to be quite challenging. We saw in the school only one close contact in the class became infected, and yet we had a casual plus contact with no apparent interaction with our original case who became infected as well. We've seen here someone who's got a sibling associated with the school who's tested negative, may have been exposed at some other event. We simply don't know. And I guess what we're wanting to be sure of, now we know that, and also these atypical symptoms, that we really give ourselves the best chance to shut this thing down and make sure that everybody who needs to is isolating and is tested.
In hindsight, given the fact that you've said all along that you wanted to err on the side of caution, in hindsight, would you not have recommended to Cabinet that it move down alert levels when it did?
I think, just as the Prime Minister said, we have responded to the information we have had, and we have been meticulous in doing so, and also I think been very precautionary. So if you think about how we've used the contact tracing system this weekend, it's put the system under pressure, and the system's responded really well. We've treated many people in a category that didn't even exist a few months ago, our casual plus contacts. Then those people that we created that category and said we will test these people after 5 days. If they are negative, we will let them go. This last week, we have treated them all as if they are close contacts. And
some people are still able to go into their workplace at this alert level. Some people are able to go and partake in contactless deliveries, contactless retail. And so, look, that gets into a set of hypothetical scenarios, which, given we had used the rules as we needed to, Tova, and we have every expectation that when we do that, people follow the rules. We cannot exist in an environment where we set rules and they simply breached consistently, because that is how we are unable to contain. Jason?
Just on Dr. Bloomfield, you mentioned that this person also worked part-time at the airport. Is there any consideration given into that this person might have contracted the disease while working at the airport, given that's in close proximity?
It's just an airport address, isn't it?
it's an airport address, so it's a 1 day a week. It doesn't, as far as I'm the information, so it's with airside or other potentially infected people. And again, I think the genome sequencing will tell us here, but it seems very likely, given that this person was effectively part of the Papatoetoe school community, that the infection has come through that route.
Just on the alert levels, I mean, in the past, you've said that Cabinet will reassess every 24 hours. Tonight, you've set a blanket 7 days. Is Cabinet going to be reassessing over that time period, or is there no chance that it's going to be less than a 7-day?
No, we will. For the sake of certainty, I would seek to move beyond that. For the sake of certainty for them. I understand how difficult it is to plan in this environment, but of course we are taking a 7-day period from today. Yes.
Minister, did this kind of bespoke new contact tracing system get too complicated? And we got to a point where it was 4 different types of contacts. You were essentially, as you say, trying to run an alert level system within a large community.
Look, I wouldn't describe it in that way. So all that we did was say, actually, usually we consider these people close contacts. We're going to be more cautious. And even if we don't know you had direct contact, we're going to treat you that way. So that's what we did. That was the right thing to do, given that this was a potentially more infectious version of the virus we were dealing with. And we were our version of the virus, person-to-person link within the high school who got COVID-19. So that's what we did. And the system demonstrated it could do that and asked those people to be isolated. Down the back.
How confident you are with the test picking up new variants of COVID, given that, in MIQ, this is some that haven't been picked up till day 12. Is it still possible there is a link with the sibling, but it hasn't necessarily been picked up in testing?
Yes, so the testing is highly sensitive to the new variants, so that's not a particular issue here. In fact, the thing that is more a determinant of the sensitivity of testing is the way the swab.
We want people to come forward. Some people might feel a bit unwell and think, oh, I maybe should have got a test 24 hours ago and I haven't done it for 24 hours. Will I get in trouble if I have COVID? We need those people to still be tested. And that is the fine line we all walk. So to every New Zealander listening right now, I know how frustrated you will feel. But ultimately, as Dr. Bloomfield has always said, it is the virus that is the problem. We still need an environment where people will speak up and come forward and be tested. And if people are afraid and they're ashamed and they are vilified, they won't. Jessica and then Tova.
Is there any possibility that any of those tests that came back negative were false negatives? Is that been a
Percentage is quite small, isn't it, Dr. Bloomfield?
Yeah, look, the false negative rate is very low, and remembering that we are also doing double testing on pretty much everyone, including all the school students. So it's very unlikely. And again, I think the key point here is the most important testing anywhere in the country is if people have symptoms. Because even, particularly if in Auckland, if there are these unidentified chains of transmission, and we've seen nothing to suggest there is, somewhere along that line, someone will come up with symptoms. And if that person gets tested, we can identify it really early. So that is really important. The testing is very good.
Everyone, and we need everyone too.
But at this stage, you said,
Yeah, look, I'm going to take the last couple because I am mindful people will want to hear about the support packages in place. So I'll take two final questions.
Prime Minister,
Henry.
can people still correct their bubble after 6 a.m. tomorrow? I.e., if they live in Wellington but are in Auckland and aren't able to leave?
Sorry, what was that?
Can they correct their bubble? Can they travel
Yes,
out of Auckland?
as is always the case, if you're in a place that is not your place of residence, you are able to, as you say, correct your bubble, go back to wherever your home is. So that is the same as what we have traditionally done.
This isn't a question necessarily, but a clarification. The 21-year-old's mother, does she represent a second community case today?
Yes, she'll be classified as a community case and a close contact of case M, so she will be case N.
Great. Have I got any? No, okay. No more questions. Thank you. I'll bring up the Deputy Prime Minister to cover off the business support that will be in place. Of course, keeping in mind we've put in a 7-day level 3 arrangement, that does mean that business supports will kick in. I'll leave the podium to you.
Thanks, Prime Minister. So yes, just to confirm the Prime Minister's statement, because an alert level increase to alert level 3 has been put in for 7 days, that triggers the wage subsidy scheme. The wage subsidy scheme is something everybody will be familiar with. It will apply nationwide, even though the alert level increase to alert level 3 is only in Auckland. The wage subsidy will be a typical week in the 6 weeks prior to this, a typical fortnight period in the 6 weeks prior to this event. It's also important to note that you can receive both the wage subsidy scheme and the resurgence support payment that has been open over the last week or so. That relates to the alert level 2 move we had. The wage subsidy scheme relates to the alert level 3. So both payments are available for businesses to take up. I also should note at this time that, to reiterate the Prime Minister's comment, that approvals granted for movement for business purposes across the Auckland boundaries that were granted just a couple of weeks ago now roll over. So they do not need to be reapplied for. For those who haven't had one before and want to know if they're eligible, they can go to the MB website for information about that. And then finally, just to note that the Ministry of Social Development has been providing significant support into the community around, particularly Papatoetoe High School. They continue to do that. And if there are families who believe that they need that extra support now, we ask them to make contact with the Ministry of Social Development. They will be standing up their contact centre from tomorrow morning. The phone number for that is 0800 559 009. That's 0800 559 009. And we do ask people, if they are worried and concerned about their ability to be able to buy food, for example, through this period, that they do make contact with the Ministry of Social Development, and we will have information up tomorrow about the process for applying for the wage subsidy scheme. The amounts of money available remain the same as they have been throughout the scheme. That's $585 per week subsidy for a full-time worker and $350 for a part-time worker, or prorated thereof. Jess.
To go to MSD if they need extra support, is that an admission that you're just not giving people enough? And that maybe, and a second part to that question, do you think that's affecting people's ability to stay at home and stay isolated?
It's not, no. What it is a recognition that there are some families for whom...
From a financial perspective...
Henry.
I'll let time finish.
No, Henry.
Yeah, no, from a financial perspective, Minister, are you now yo-yoing the country in and out of alert levels and costing the taxpayer upwards of $500 million?
No, I don't believe so. You've already heard from the Prime Minister and Dr Bloomfield that we acted on the advice and the information that we had at the time. We have the capacity through the hard work of New Zealanders to be able to support people through this. That's what I'm up here talking about.
Are you absolutely sure that all that money going to the businesses whose employees had to self-isolate is getting to those workers and it's not just being kept by the companies?
Oh, well, if there is any examples of that occurring, I'd like them to be drawn to my attention. Employers know what their obligations are in these situations, and if that is happening, I would know what their obligations are in these situations, and if that is...
The kind of people who are utilised workforces, you say, do you think they're...
Well, as I say, if there is any concern about that, that should be brought to our attention. We've got through this over the last year by employers and employees working together. And in the vast bulk of cases, that's what happens. If there are cases where people are concerned about it, we follow them up, just as we did with the wage subsidy scheme and just as we would do with this.
Sports hat on cricket, do you know how this is going to repeat for cricket?
Yeah, well, obviously, I don't yet, but obviously in terms of Auckland, next Saturday they will be in alert level 3, so that game would not be able to take place. For the other games, it is still possible to play.
As to the direction that you've announced tonight?
Certainly on the latter point, yes, it was. Obviously, those are matters for the Prime Minister primarily to discuss. I believe the call started at around 7:45 p.m.
From an economic perspective, is it better to stay in a higher alert level longer or to move up and down alert levels on the weekly?
Yeah, well, we haven't done the latter point. What we've done is actually take the advice that's been given to us. We always think about the economic consequences alongside the health consequences, and I think as a rule over time, New Zealand has done relatively well, has been able to operate in terms of a business environment relatively well, and we take the decisions on the advice that we have, but we have this buffer available to be able to support people, and I think that's important.
Would it have been better for business if Auckland had just stayed in alert level 3 throughout?
I think overall, throughout the last year, what's been good for business and good for all New Zealanders is us taking the advice of experts. We took that advice and that's what dictated the decision we made, similar to tonight.
Experts have constantly said yo-yoing is the worst thing for the economy, so isn't yo-yoing the worst thing for the economy?
No, the worst thing for the economy would be to have a massive outbreak of Covid-19, and we haven't had that, and we won't have it again.
Level 3 for longer.
Any other questions? Okay, thank you.